signing in from. My name is Bianca Feidelberg, and I'm a project lead here with the OCO, and this is the Essential Care Partner Practices in Ontario Health Teams, an opportunity for improved patient care. So before we get going, I'm just going to start by offering a land acknowledgement. And so while we are meeting here today on a virtual platform with people joining us from across the province, I wanted to take a moment to recognize and speak to the land from which I'm speaking to you from, which is the traditional territories of many nations, including the Huron-Wendat, the Anishinaabe, the Chippewa, the Haudenosaunee, and most recently the Mississaugas of the Credit River First Nation. And the area is covered by Treaty 13 with Mississaugas of the Credit, also known as the Toronto Purchase. And today, this gathering place is home to many First Nation, Inuit, and Métis people. As OCO team members, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. And we do this to reaffirm our commitment and responsibilities in improving relationships between nations and to improving our understanding of local Indigenous people and their culture. And we are grateful for the opportunity to live, work, and learn on this land. And this is a photo of a park near my house that I often spend time in, and I truly feel so privileged and grateful to have the opportunity to spend time there individually and with my family. So this is a winter scene. I often show this image of this park with other seasons, but again, grateful for to be able to work and live and play on this land. If you don't know the land from which you're kind of speaking from or attending from, we encourage you to have a look at nativeland.ca, and we'll pop that link in the chat. Next slide, please. So we are the Ontario Caregiver Organization, which really exists to improve the lives of Ontario's caregivers. So no matter where caregivers are caring from in Ontario, who they're caring from, or the diagnosis of that person, we're not for profit, and we're funded by the Ministry of Health. Next slide, please. Wanted to just share a little bit about how OCO works. So at the center and heart of all of our work are caregivers. So we work with caregivers to gather insights and engage caregivers to inform our programs and services and practices. And certainly then we work to help the public understand the important role that caregivers have, provide information about the caregiving experience. We currently have a project underway called the Undercover Kindness Project that really highlights experiences of caregivers across the province and shares stories of acts of kindness that we've been able to offer to caregivers who are playing such an essential role of somebody they are caring for. And lastly, we offer direct programs and services to caregivers. And I will say also that our team and the team here today works closely with system partners like yourselves, like OHTs, to really help you think about how you can include, identify and support caregivers across your settings. So I'm really pleased to have you all join here today. Next slide, please. So this is a bit around how we at OCO work with Ontario Health Teams. Certainly we have these three pillars that we like to focus on, and we're going to spend a lot of time talking about those today as ways that you can integrate caregivers across your settings. The first is formally identifying caregivers. The second is including caregivers at point of care. And the third is supporting caregivers, connecting them to support for their own well-being. We do this all with the underpinning of meaningful engagement of caregivers as experts in their planning, in the planning and design and delivery of your OHTs. And what we've really noticed is that when caregivers are meaningfully engaged as partners from the beginning, it results in caregiver needs showing up in the care and design at point of care in your care plans and delivery. And you'll hear more about that from Couchiching OHT today. On the right, you'll see those 4 areas that we offer in terms of how we work with Ontario Health Teams. We offer big learning events like this across to OHTs, but we also work to provide tailored education sessions to your OHTs. We offer tools and resources, and certainly today we are launching some new tools and resources that we're really excited to be sharing with you. And we are happy and eager to work more closely with you by having meetings or collaborating or guidance and support, offering guidance and support about how you can integrate caregivers across your OHT or system. And lastly, the connection of caregivers to support and ensuring that caregivers are connected to, we have a plethora of resources and tools available on our website for caregivers. Next slide, please. So what you'll walk away with today or learn today, we hope that you'll leave with a real understanding, a deep understanding of the caregiving experience, its impact on caregivers and on patient care. We have a presentation today from Couchiching OHT that we're really thrilled to highlight, where they will share with you how they've implemented essential care partner practices across their OHT. And we'll leave you with some new tools, resources, and actions that your OHT can take today to implement essential care partner practices across your OHT. Next slide, please. So today's presenters, Andrea Ravazzi and Chris Archer from Couchiching OHT will be part of the presenters today. We're thrilled to have them. Andrea wasn't able to join us in person, but she has shared a video that we will be sharing later on in the presentation, and we look forward to hearing from Chris. I'm joined by my colleague, Allison Kilburn, and behind the scenes is Fardosa Helene, who's working to make all of this come together. And my name is Bianca Feidelberg. And we're just pleased to have you all here today. Next slide. So this is a context or a snapshot of Ontario's caregivers. We have 4 million caregivers across Ontario, and this includes young caregivers. And I wanted to just draw your attention to the part of the slide that shows that 40% of caregivers are between the ages of 45 and 64. And that's really a reflection of, those folks are in the part of their careers or their working careers, and 64% of caregivers are employed. So what makes me think about this is that many of us here on the call or the session today identify as caregivers. Next slide, please. The other piece to consider as you're listening is that 48% of caregivers are part of what's called the sandwich generation, which I would identify in that as well, where I am looking after aging parents and in-laws, but also raising small children. And then the other the piece is 49% of caregivers, the care recipient is living with them. So as you're hearing about essential care partner practices that we're talking about, the identification, the inclusion, the support of caregivers, consider these key pieces of information as a bit of context of how many folks are caregivers across the province and what they might be engaged in throughout their day-to-day. Next slide, please. So as I mentioned, Andrea is here, wasn't able to be here today, but she was very much a part of this planning and this session, and she wanted to share her experience through this video. So I'm going to get Fardosa to hit play, and we can hear from Andrea.
2015, I began my caregiving journey, although I didn't realize it at the time. My husband suffered a heart attack and cardiac arrest, and when his heart stopped, he fell and hit his head. And we now live with the effects of a mild traumatic brain injury, but its impacts have been anything but mild. When I arrived at the hospital, they sent me to the quiet room, and I was certain he had not made it. Finally, the doctor arrived, and she spoke to us, and I'm sure she said a lot, but all I heard was defibrillated several times, trying to stabilize him for transfer to another hospital. When he was finally stable, he was transferred and underwent surgery and was put into a therapeutic coma for about 2 days. He remained in that hospital for 5 days and was transferred back to the original for another 4. We were discharged with lots of information about his heart, no information about his brain, or the journey that he, me, and we were about to begin. I think it's important to say that I use pronouns like he, that we, and us, and I do this deliberately. While the brain injury physically happened to my husband, it also happened to me. It happened to our children, to our grandchildren, his extended family, and mine. It happened to all of us, and it was a traumatic event. We saw many doctors and therapists, and everyone with my husband as the priority, and that wasn't wrong. But there was an equally important priority that was always overlooked: me. How was I feeling? How was I managing? What did I think? Both of us had very different perspectives. I was even told once by a doctor that they wanted to hear from the patient, although that patient had cognitive and memory difficulties. Everything I learned about how best to support him, I learned from the internet. And lucky for us, I was using reputable sites like Brain Injury Canada and the Ontario Brain Injury Association and the Heart and Stroke Foundation. In fact, it was me who pushed for post-concussion symptom diagnosis, me who researched treatment and rehab opportunities, me who kept track of appointments, organized weekly medications, managed household tasks, managed finances, filled out forms, and repeated our story at every appointment. And at this point in my journey, I didn't consider myself a caregiver yet. He's my husband, I'm his wife. Of course, I would support him, worry about him, and take care of him. So when you're checking on someone and they say things like, I'm fine, they probably aren't. You don't experience a life-altering event or a diagnosis without it affecting and changing everything. And I remember feeling sad, scared, angry, and sad at different and at the same time. I felt so alone. In 2017, I started to acknowledge that I was overwhelmed. I was quick-tempered, I was crying, I wasn't sleeping well, I was struggling, and I didn't understand why. Excuse me. The more research I did, the more I realized that I was a caregiver. I learned that my feelings and experiences were very normal, but most importantly, I learned that caregiving was hard. I grieved for my husband and life partner. I grieved for a future that would be forever changed. I didn't know how to reconcile my gratitude that he was alive with my sadness that things were different. My mental health has been significantly impacted. The good news is I've taken several steps to manage it. I've been to counseling a few times. I've taken medication. I participated in a mindfulness-based stress reduction course. I participated in the Bounce Back program, and I utilized my EAP. But probably the most important thing I did was acknowledge myself, my feelings, and I started talking about it. When people asked me how I was, I told them. I'm often told how resilient I am. I say thank you, but really, what choice did I have?
Such a powerful reflection from Andrea, and I just am so struck by so many things in her her video, and I know she really wanted to be here today, but her reflecting on how she didn't identify as a caregiver, all the things she's doing as a caregiver to manage and support her husband in that role, and then of course her well-being. And recognizing that when caregivers are not doing well, they're at risk of becoming patients themselves. And, we heard from Andrea about her mental health, and we heard how she was struggling and how her caregiving journey really impacted her and her family. And the risk of caregivers burnout is that there are, 4 million caregivers across the province, and there's a risk of those caregivers, if they aren't already, requiring care in an already stressed healthcare system. So just thinking about that, next slide, please. And then what impact does that have on patients? So we certainly know that when caregivers, and we heard from Andrea, when caregivers aren't doing well, then it impacts their capacity to care for the person that they're looking after. And it can lead to increased use of emergency rooms. And certainly we've heard examples or stories, very difficult stories from caregivers share about how, they really didn't know what to do. They were burnt out and had to leave their care recipient at the emergency room because they didn't know what to do and they were so burnt out. So certainly thinking about all these pieces as an important factor as we're considering about the critical role of caregivers. Next slide, please. So I love this quote because I think it just really emphasizes how critical caregivers are. And when we were preparing for this presentation, Andrea reminded me, caregivers are critical as part of the care team together. They're equal partners in this system, and recognizing that their well-being, their role is so important and significant to our whole system. And so yes, just wanted to leave you with this as we move into the next part of our presentation. So I'm now going to ask for the next slide, please, and going to pass the next part of the presentation over to my colleague, Allison, who's going to walk us through the important piece of work of partnering with caregivers at point of care. Thanks, Allison.
Thanks so much, Bianca. I'm really excited to be here. Let's start with the next slide, please. So really excited to be here to talk about caregivers as essential care partners. We have a real opportunity to integrate caregivers in our health system and across OHTs, so they are consistently empowered to be essential care partners in patient care. When we were meeting and planning for the webinar today, Andrea reminded us that caregiving is not new. Caregivers have been doing this forever, but being recognized and included is new. And that really stuck with me. And so I want you to keep that in mind as we move forward. Bianca provided a great snapshot of Ontario caregivers, and it's worth noting that, of course, of those 4 million caregivers, they actually provide an estimated 75% of the care in our health system. Many of you might be familiar with our Partners in Care equation, which illustrates how patients, clients, or residents, depending on the care setting, caregivers and care providers work together and really work together as partners in care. And then that equation, of course, contributes to the quintuple aim. And in particular, caregiver inclusion and support enable things like improved transitions across settings, decreased emergency room usage. All of those pieces of the puzzle kind of all fit together. And I'm going to dive a little bit deeper into some of those elements as we move forward. Thanks. Next slide, please. So I want to look a little bit closer at the Partners in Care equation and talk about why this is so critical in practice. Of course, partnering with family caregivers is an essential feature of a high quality healthcare system, but why and what kind of value do they bring? We've often heard from caregivers like Andrea that they're the glue that hold it all together. This is especially the case when we think about continuity of care, especially at those big and small transition points. I was speaking with a caregiver who's caring for her mom in long-term care just the other day, and she remarked that actually due to the kind of high turnover of staff in her home, she had noticed that she was actually the most consistent person for her mom and would in fact help smooth transitions for new staff coming on board, especially during those shift changes, by introducing them to each other and her mother and herself. And it's funny because I had not thought before about that kind of continuity, even from that perspective. When we think about some of those important transitions, we often, of course, think about those big hospital to home shifts. It's really worth noting that the caregivers, if there hopefully is one, is often the determinant of a successful transition home, because they're the ones carrying out the implementation of the care plan, even if they were involved in creating it. This means managing those follow-up appointments, helping to coordinate additional supports at home, not to mention all the other kind of home tasks that Andrea alluded to as well. In addition, especially at kind of key entry points and assessment points in the system, caregivers provide critical patient information that assists clinicians to provide safe and appropriate care. This, of course, is even more critical if the patient has communication barriers, a complex medical history, or unique sociocultural needs. Finally, in a recent study of families as partners in hospital error and adverse event surveillance, it found that family reports identified a number of preventable adverse events that were not identified by clinicians, and also that family reported errors were 5 times higher than hospital staff reports. Of course, the study concluded that families provide unique information, particularly about hospital safety, and should actually be included in hospital safety systems to improve patient safety overall. Next slide, please. So, the evidence is clear. Patients, clients, residents do better when care partners are actively included and involved. Before I go into some of the benefits, I wanted to reflect on, how we know this. We know this already, but we certainly know it now from some of the really hard lessons learned during the pandemic, when caregivers were not able to be present or included in a number of settings due to visitor policies and restrictions. The unintended consequences of those restrictions has in fact provided additional evidence about the essential role caregivers play and the benefits of caregiver inclusion. I want to highlight a couple of those benefits. So some of those benefits really mean improved patient safety and care, and I provided an example from those adverse events previously. This looks like more equitable and culturally safe care because you have a caregiver who knows a patient best and is able to advocate or communicate their needs that they might not otherwise be able to communicate to the healthcare team. These are looking at other benefits like improved healthcare outcomes, lower readmission rates, sustained cognitive function among older adults. And this also looks like improved quality indicators, including reduced falls, better medication adherence, all kinds of both micro and macro examples here. All of these benefits really add up to less pressure on the healthcare system, efficiency for Ontario health teams, and the system as a whole. Next slide, please. So all of these pieces kind of form together into what I wanted to talk about is, what is an essential care partner program? This involves the implementation of practices, policies across your OHT, your community, where caregivers are identified, included, and supported to participate as part of a care team. This kind of program can help address those pressures on the healthcare system while improving patient care and health outcomes. It can also really help to solidify an OHT's commitment to recognizing caregivers as essential partners in care. In particular, it can really lay the groundwork for that smoother and more consistent transition across different parts of the system for patients. It's also a real opportunity for the consistent push towards more person and family-centered care across a full continuum of care. Every OHT, of course, is unique, and so that means that essential care partner and programs and practices may look or feel different across regions, across settings. But generally, again, we really look at these 3 pillars in terms of identifying the caregiver, including them, and empowering them to be part of the care team, and then ensuring they have the supports they need in their role. Next slide, please. My work at OCO focuses on our Essential Care Partner Support Hub. In March of this year, in partnership with Ontario Health, we launched our Support Hub. But this initiative is actually really based on work we've already been doing over the past 3 years, working with health system partners to improve the caregiver experience. This, of course, began at the outset of the pandemic when we started a learning collaborative that brought folks across organizations and regions together with a focus on the safe presence of caregivers in healthcare settings. It's, of course, evolved as the pandemic evolved from a focus on presence really to an emphasis on caregiver inclusion. Our Support Hub team provides great coaching guidance to organizations, and we host a number of knowledge exchange events and activities to really help support and guide organizations to adopt, enhance, or implement essential care partner programs. And we're, of course, really excited to offer some of these resources for Ontario health teams. Next slide, please. I wanted to highlight one of these resources now. This is just a one-pager that highlights key practices for Ontario health teams to consider when thinking about an essential care partner program. Based on learning from healthcare organizations and OHTs that have implemented essential care partner programs and practices, we've identified 9 key practices, 3 practices under each pillar, for OHTs to consider when thinking about implementing an essential care partner program or practices across your OHT. I won't go into all of them here, but I just wanted to highlight one per pillar. So, one fairly obvious one that many of you might be familiar with already is formally including caregivers, and how you might do that is using some form of formal caregiver identification. This looks and feels different across different settings, but this is one way to formally recognize essential care partners. Under the kind of including caregivers pillar, one of the key practices I wanted to highlight is the importance of staff education and training. Your caregiver ID badge will only be effective if the staff and care teams recognize it and value the contribution of that essential care partner. So providing education and training to our teams, our staff across your OHT is an important element of that inclusion. And finally, under supporting the caregiver, one of the most important key practices is really linking to caregivers to the support for their own well-being. And Andrea spoke to this so well. This is really where I think OHTs have such an opportunity to leverage community partnerships, existing caregiver supports happening already locally in their region, to ensure that essential care partners across your OHT are well supported. Now, I am delighted to welcome Chris Archer, co-director of the Couchiching OHT, who is going to talk about the integration of essential care partners across Couchiching. Over to you, Chris.
Wonderful, thank you. Hopefully you're able to hear me. A few technical difficulties this morning. Just need a thumbs up to make sure we're good.
We can hear you, Chris. Thank you.
Wonderful. We'll go to the next slide and we'll give you a little bit of an overview of the Couchiching OHT. So again, thanks so much for the opportunity today, and really the partnership with OCO has been nothing short of fantastic. But its origins, kind of are rooted in our decisions around the identification and the inclusion of our PFAC members, our Patient Family Advisory Council, at the very early stages of our OHT. So I'll talk to you a little bit about that, but overall, I wanted to talk to you quickly about where we are, what we're doing, how we've started to use the framework of identification, of inclusion and supports into some of our programming here at our OHT. And we are far from perfect, but we do have some pieces in place that have allowed us to have some early success. Next slide, please. So who is Couchiching OHT? Just quickly, we're on the shores of Couchiching, Lake Couchiching. We kind of Aurelia, Oro-Medonte, Ramera, Severn, Chippewas, Zabrama First Nations are kind of the surrounding areas that are included in our attributable population, which is 67,000 patients, and in our geography population of about 90,000. I've listed just our anchor partners there in terms of those are the decision makers, what we call a joint executive team of 12. And then we have over 35 actually affiliate partners that are part of our collaboration table that meets on a monthly basis in order for us to inform and be informed by what our partners in the community are doing. Next slide. Super busy slide. I apologize, but this will allow me to illustrate kind of how we approached our PFAC and caregivers right from the get-go. So again, we are a cohort 1 OHT. So right back to 2019. And back in 2019, because of the makeup of our relationships across organizations, we knew at an early stage that we wanted to have patients at the table as part of our discussion. So when we first got together to talk about being an OHT, we had patients involved and caregivers involved right from the outset in the early planning. So where has that evolved? It's evolved to the point where if you look at our very top box, we have our JET, which is our joint executive team. So we actually have 2 PFAC co-chairs, but we have 1 voting member as part of that JET. So they're involved with all of our decision making and influence and encourage and in some cases really drive the agenda from a patient's view. And without that, we would not be where we're at today as an OHT, as well as where we're at with our relationship with the caregivers as well. So I leave you with that thought. And then if you look under the governance section, our future state will be more of a patient and family network. And again, this is the vision of our PFAC members. And so really looking to how do we branch out? How do we build on what we have currently? And the last point that I want to make on this slide is that we don't have a large PFAC, but we have representation at all of our working groups. We have a PFAC member that feeds back in again to that decision-making body, which is the JET. Next slide, please. I wanted to just also share that Couchiching is an accelerated OHT. And I share that with you only to let you know that as we've moved forward with things like, implementing clinical pathways and developing those, and those are on the front burner for us, as well as developing a primary care network. We have had our PFAC members at our engagement days to inform the process. And again, they are more than just baked in. They're driving a lot of this work as it supports the improved patient outcomes, which is on the right-hand side around increasing the early detection of chronic disease, improved chronic disease outcomes, reduced acute care utilization, increased access to primary care services for unattached patients, improved system navigation support to find access care. And I'm going to show you some of our system navigation work, and then increased access to integrated team-based models of care. So again, at the onset, baked in now, driving future state for an accelerated OHT. Next slide, please. Super busy slide again. What I really want to share here is the important part is that we have been very driven by the importance of navigating patients and holding a patient's hand through the system in order for them to get from provider to provider and to access the organizations that are best going to support their care. This is representation of what we've done around navigation, kind of a one number to call, partnership with community connections or 211, in order that we have warm handoffs to all of our programs. I'll point out in the middle of this slide, we've obviously got our palliative and mental health and well seniors, but we actually have a direct link for caregivers seeking supportive resources. And that warm transfer goes right to OCO in order for them to access that number and utilize the resources with OCO. So again, busy slide, but just a representation of how it is instrumental in everything that we're doing. And the caregivers are a big part of making sure that is part of our thinking. I will also add, and I noticed there's some family health team staff on here, we've actually at our own organization level, because a lot of this has been representing the OHT ideology and thinking, but the family health team actually has caregivers built into one of our pillars for system planning moving forward. So again, just supporting the work and the need and the importance of this in our area. Next slide, please. So again, getting back to looking at identification, inclusion, and support, we actually have an Essential Care Partners program at our hospital. And so again, this was identified in early 2022 while visiting was significantly restricted during the pandemic. And so kind of in a nutshell, we have evolved our Essential Care Partner program where we do have a badge. We have a training and an identification process where OSMH staff is asked to identify and making sure the person is appropriate. We have some training that the actual patient goes through. It's an IPAC education component. It's a video, and it's kind of we create a collaboration contract in order for us to make sure that we have this identification badge that is given to our Essential Care Partner programs, and then given full access. The way this evolved was initially we just used two different floors of the hospital, and this has since been expanded to the entire hospital. So we've implemented, again, how do you identify, how do you include, how do we support, and this is our approach to that. On the next slide, and I'll move to the next slide, please. I'd like to just talk a little bit about where we would like to go with this. So again, we've talked about some of the work we've done at CFIT, one organization as part of the OHT, OSMH, another organization part of the OHT. And so we would love to, the vision here, and there's a lot of work to be done, is a single program spanning all of our care settings, a vetting process that covers all of these settings, identified at one door and valid across all settings, regular and structured contact with clinicians, full access to the facility and the patient, equal access to patient health information, and at the table for clinical decisions. Again, we'll talk about the training and identification of two per patient. So this is really an important part of what our vision is. And again, it comes from the fact that our caregivers, our patients are sitting at all of our tables as we make decisions moving forward. So I'll move to the last slide, and I'd like to give a little bit of a summary of some of the other things that we're doing. So I think it's important is through this process, and please flag me if I'm going over time, is that the voting member of the JET is critical. We actually shifted the name at one point from kind of a committee to council, where we rely on this as part of our decision making. We actually have had a caregiver, an all-day session that we did way back in April, in order for caregivers to bring their stories to the table and to socialize and integrate and just work and understand each other and how important this work is. We've had an OHT staff and provider education sessions that were extremely well received. And then obviously building caregivers into the access and navigation model, as I mentioned. So with that, I think I'm at time, happy to answer questions, but I really reflect back on as much work has been done. There's just so much more to be done. And again, we thank you for the partnership with OCO in order for us to have this collaboration. Thank you so much.
Oh, Chris, thank you so much for your presentation. I just, there were so many things that I love about it, but in particular, I love how you really reflected about how caregivers were embedded from the get-go, and that really set the foundation for your work across the OHT. And you can really see how it has, spread itself across the OHT in terms of the various ways that you have moved to really implement essential care partner practices that we're talking about. So the identification, the inclusion, and the support of caregivers. So thank you so much for taking the time to chat with us today. We would invite you to, if you have any questions. Oh, sorry, Chris, you want to go add something?
Important to add one thing, and I know that we talked about this before, and it may come up later, that it's really, really important to know that we weren't always ideologically structured to have caregivers and patients as part of our thinking. Even though we embedded it in 2019, I remember clearly conversations with clinical groups and others that were very hesitant, because this was new ground for them to break. And again, until we made that shift, and my advice would be is if you haven't engaged, fulsomely, have them engage in and address those tensions that might exist. Now, we also had 2 or 3 real strong go-getters at the beginning as well that wanted to jump in. And I think that strength of voice is really, really important. But I think it's important to know that we got there after we addressed some of these tensions, allowed the conversations to happen in meetings that maybe wouldn't have in the past, and then just let it evolve, because you will see the value just with them contributing to some of your decisions, your future state planning, your strategy. It's critical in order to have success.
I love that, Chris, just leaning right into those difficult conversations and tensions, because in the end, the result really has so much impact, is what I hear you saying. Thank you. I just love that. So leaning right into those tensions and those conversations. I'm going to ask if people have questions for Chris, if you can pop them in the chat, and then what we'll do is in the last 10 minutes of the of our presentation or time together, we'll go back to questions, and I'll just ask Fardosa if you can take it to the next slide, and I'll move into this last part of our presentation where we're going to share some examples, actions, resources, tools, new tools that we have to help support your OHT in the support, inclusion, and identification of caregivers. So next slide, please. So one of the, the key ways, as we've talked about, is the formal identification of caregivers. And we recognize that as OHTs and systems, there are many challenges that folks are facing. So improved transitions in care. We know that there has been a lot of impact from COVID-19, health, human resources. So we recognize that OHTs are managing many, many challenges that you're facing. But we also see this as a real opportunity. We heard earlier from Andrea just how important it was to the self-identification as a caregiver, and there's a real opportunity for caregivers to self-identify, and that can really result in decreased burnout and isolation. So we would encourage OHTs to explore these solutions and actions that you can take as an OHT by implementing caregiver ID across settings, or starting with a few initial settings, finding ways to document your essential care partners in your patient files and records so that they can move with the patient through and across transitions and systems of care. I wanted to highlight that Hills of Headwaters Collaborative OHT has been a real lead or champion in this work of identifying caregivers. They implemented the Caregivers in the Hills program, where they recognize caregivers across their region with an identification badge and connect them to support. And we've highlighted their very important work in our Essential Care Partner Program Implementation Toolkit for OHTs. This is one of our new resources where we give 2 examples of OHTs that have implemented Essential Care Partner Practices programs, Caregiver ID, and across their OHT, and with tools, resources to help you along the way. And the other resource that we're highlighting that's new and that Allison shared earlier on is the Essential Care Partner Program Key Practices. So that's really a one-pager that highlights those key practices that you can implement across your OHT. Next slide, please. The second key practice is the inclusion of caregivers. So we recognize again that as a system and as OHTs, we're working hard to meet the needs of vulnerable patients, aging older adults and populations. And we also recognize that as OHTs, you've been tasked with deliverables such as reducing your ALC days and being tasked with integrated care models and looking at those. So we see this as an opportunity to improve those transitions for those populations, to support coordinated and sustained care plans. And this can be achieved by really thinking about how, and we heard from Chris earlier about how caregivers are integrated across the system, where you're looking to build processes, provide training to include caregivers. If caregivers are included in early assessment, transition planning, that can improve those transitions. There's also this opportunity to really think about how, as you look to your integrated care pathways, how are caregivers included in those processes? Across that journey, how and where can caregivers be included? We have OHTs that are working hard to achieve some of the integration and inclusion of caregivers. Certainly, we know that Algoma OHT has initiated the Caregiver ID program across their region. And in addition, we're working with Northwestern Toronto OHT that is really focused on the inclusion of caregivers at point of care as they plan for improved transitions in care and reduced ALC stays. So they have integrated 2 projects, improving transitions in care and reduced ALC stays, with the goal of implementing shared outcomes through their deliverables as a best practice spotlight OHT and as a part of the deliverables of their ALC working group. So those are the ways that OHTs can really, you can think about how you might integrate caregivers and include them across that work or those work areas. We have 3 new resources here that I wanted to highlight. The first is really focused on the essential role of caregivers in improving transitions and addressing ALC. And then the second is a essential care partner practices for Ontario health teams. So, and the last is a guidance document talking about how you can integrate and engage caregivers to meet your OHT deliverables. All of these resources show you the evidence and tools and actions that you can take on a real continuum, from a very involved programming in terms of implementation of a caregiver ID across your OHT, or from less involved practices where you might point caregivers to support. Which leads me to the last slide. If I could ask you to share that, please, Fardosa. Support for caregivers. So again, we know that there are system challenges, increased emergency room usage. We heard from Chris earlier about the improved system navigation that OHTs, we know OHTs are working very hard to achieve, in addition to system challenges, those deliverables. And there's a real opportunity to decrease caregiver burnout, to link caregivers to support. And so, we heard from Couchiching OHT about how they're working hard to embed OCO and the helpline into their connection to support for caregivers into their access and navigation model. We also know that South Georgian Bay OHT is doing this as well. There are a number of other OHTs who are working towards this, this activity, but really encourage you to think about ways that you can action some of that. So include OCO in your access navigation models, as those examples have shared, or referring caregivers to OCO, making sure that your partner organizations are well aware of the resources and tools available through OCO, or as Allison mentioned earlier, your local community organizations and what they offer for caregivers in terms of support. And lastly, point to OCO on your OHT website, which we know a few OHTs have already done. In our new resource, including caregivers and access and navigation models, we point to all these types of activities and, again, evidence and tools and links to help you in this effort. I'm going to take this opportunity to move to this last slide here. This is, I see this as an inspiration for OHT. So what we have here is a map of all of the Ontario health teams across the province. And we have allocated pins for where, red pins, as you can see, of where hospitals are connected to our ECP support hub and are perhaps exploring essential care partner program implementation, or have already implemented. So I leave it with you as a sort of inspiration to consider how you might connect in with your local hospital or hospitals that are involved in your OHT to see if they have essential care partner programs in place or practices in place. Or you could certainly reach out to us to make that connection, or think about that connection and how it can be expanded. As Chris shared that vision of expanding essential care partner programs and practices across a region or OHT to really make for seamless transitions in care. We are now going to move to questions from the audience. I just want to see if we have any questions in the audience that have come up. And I invite Chris and Allison to go on video, and we can see if we have any questions from the audience. Let me just have a peek here. I think there's been lots of sort of accolades to the work that's happening across your OHT. One question I know that has come up, Chris, is just thinking about the barrier. What's the barrier that you think your OHT has faced in terms of integrating essential care partner practices?
Yeah, I think really it's one of the, I'll share another barrier. The initial one that pops up is as I mentioned, is just the reluctancy and seeing the value, I guess, initially, until you have patients and caregivers as part of your working group. So that there was a little bit of a barrier there, and it was just a bit of a shift in thinking we've never done it this way. And then in terms of kind of other barriers, I think it's growing our PFAC. I think that's our we need to do a better job of that. We've done several call outs. We talked to our collaboration table and constantly looking to recruit new members. But you know, in terms of where we need to go with this in the long term, I think there's power in numbers and more voices. And so in terms of offering a solution to that, I think we just kind of keep at it and keep sharing the good work that's happening, and obviously keeping them front and center to any kind of outward facing updates on OHT, just all the work that's being done. So I'm hoping those things will continue to support, but also address some of the challenges and barriers that we've had so far.
Thanks so much, Chris. I really appreciate that, the reflection of sort of other barriers and how you're getting it. And I certainly don't think your OHT is alone in that. We've heard that from many OHTs, but thinking about how to ensure that there's enough a voice or representation from patients, caregivers at the table. Allison, do you have any other questions that you might want to ask or that you see have come up?
Sure. I think there's a number in the chat, and I'm thinking we probably won't get to all of them. I really appreciate everyone's kind of input and notable kind of comments in the chat. I'm just seeing a question from Jennifer around understanding of essential care partners versus power of attorney. I know that kind of questions around privacy and consent often come up. I'll pop it in the chat later, but the first thing I would do is just point to some of our existing resources that talk about the importance of ensuring that privacy and consent are not barriers for caregivers participating as partners in care, and that there can be a lot of great education done for staff as well as caregivers on really understanding those roles. But also just a bit of a heads up that in the new year, we will be actually offering some further education from the Essential Care Partner Support Hub on some of the nuances around privacy and consent, substitute decision making, essential care partners, power of attorney, and how that looks. So that's a bit of a stay tuned, but I'll also pop those other resources in the chat.
Thanks, Allison. There's a lot too. I see lots of questions just about you know, how to that, and also lots of questions about thinking about how one decides on, you know, how many caregivers to have or essential care partners to assign. I don't know, Chris, if you have any comments on that.
I know that the magic number became 2. How they came to that, I'm not quite sure. Again, a lot of this was OSMH driven, and there's other CFIT staff kind of on the line here. So I don't know how they came up with that number, but I know it was definitely a big part of their discussion. What is the magic number? I would assume there is no magic number, but 2 seems reasonable. And I know that, again, our PFAC weighed in on that number. So we're happy to have landed there. Is it the perfect number? In all situations, I would say no, but it is the number that was informed by our PFAC.
I love that. Really leaning back on the expertise of, your PFAC members or your caregivers involved in the work.
Happy to jump in as well, Bianca, and offer this
Sure.
is something that in conversations with folks across the province, I know certainly organizations are struggling with. I think some of it is just often a tension between wanting to be as inclusive, open, and equitable as possible for patients, while also balancing some of the very real concerns around logistics, managing kind of multiple badges, if that's in play. A number of organizations have taken a no limit approach, and other organizations, and Chris gives some great input there in terms of, okay, landing on 2, it doesn't mean that can't be revisited later. And in my experience, those oftentimes, sometimes more definitive numbers come with fairly healthy exception processes for when 2 is actually doesn't work for that particular patient.
Thanks, Allison. Really appreciate you jumping in there. I think in the interest of time, what we'll do is we'll have a look at some of the questions and see what we can answer kind of in follow-up materials. We will be sending along a link to our resources. I might ask Fardoza if you could go to the slide that shows sort of our key, next slide, please. There we go. We have some key takeaways and resources for OHTs. So we really wanted to highlight before you go that we will be sending out a link to all of these new resources, which are now hosted on our website today. Yay! And so we're pleased to share them with you, really focused on the identification of caregivers, the inclusion of caregivers, support of caregivers. And you'll see here there are 6 new resources that we have. One is focused on, as we said, key practices. The other one is looking at ALC and improved transitions in the role of caregivers. Essential care partners in a module all about key practices that's in a bit more detail. We have a guidance document that really links the integration and engagement of caregivers to your OHT deliverables. We have one that's focused on caregivers and access and navigation models, as I said. And then the last one is the implementation toolkit for OHT. So a number of great new resources for you to have a look at, and we'll be sending those along. And lastly, you know, before we wrap up, I just wanted to share how thankful we are for Chris and Andrea's expertise. And, you know, I wish Andrea were here. I know she'll watch the video, but we want to say thank you, Andrea, for sharing your really very personal journey and how much we appreciate that, and really helping us to remember throughout this presentation about how important and significant caregiver roles are. And Chris, thank you for really bringing it to life, showing us all these ways that these key practices can happen at an OHT level and sharing it here today. And lastly, I just wanted to say a big thank you to all of you for taking the time out of your lunch hour to join us to learn about this important work. So please reach out. We're available and happy to connect with you to talk more about our resources, and wishing you all the best. Enjoy your day, everyone, and thank you.